recumbency?
是仰卧保定呢，还是侧卧保定呢？
A systematic approach to scanning the abdomen.
以及怎么样系统的检查整个腹腔？
Imaging planes and orientation so that you can look at anybody's image and know the orientation of the organs.
然后你检查的这个图片的它的一个方向，这样的话你可以看任何一个人留下来的、保存下来的图片，你知道它的那个图像的方向在哪里。
And then just a little bit about ergonomics so you protect your back and your wrist and your shoulder.
然后还有一点点关于这个功效学，就是你怎么保护自己的肩背，还有你的脖子、手腕。
Okay, so for patient preparation, first we clip the hair.
准备动物的时候，我们需要剃毛。
And we use the electric clippers usually.
我们一般用电剃刀。
And if you're clipping for dorsal recumbency or with the patient on their back, then we typically clip along the ribs and then the rest of the abdomen.
如果说你是把那个动物仰卧保定进行检查的话，我们通常是沿着肋弓剃，然后把肋弓往下的那个腹部全部剃掉。
And you may find that you often need to clip a little more on the right side, so you clip over the ribs a little bit on the right side to see the right kidney and liver and maybe pancreas structures in that region.
一般有可能大部分情况下，你需要在右侧剃得稍微高一点点，这样你可以比较容易找到肝脏那个叫12指肠，还有右肾，还有胰腺。
And if you scan in lateral recumbency or with the patients on their side, then you'll need to shave higher up on the sides.
如果说你是用侧卧位保定的话，你就需要在侧卧位那个位置多剃一点毛。
So after you've shaved, a lot of times you have a lot of loose hair, so you need to get the loose hair off the abdomen because otherwise that will create artifact. So you brush it off or use a vacuum or a towel.
当你剃完毛以后，有很多那个剃下来的毛渣，这些东西的话，你需要清理掉，要不然它们会产生一些回影。你可以用刷把它刷掉，或者拿吸尘器吸掉，或者拿湿毛巾擦掉。
And then we apply gel to the entire abdomen. And I like to go ahead and put gel on the whole abdomen first because it kind of soaks in and may improve your image later.
然后你可以在整个腹部涂抹耦合剂。一般他个人比较喜欢，你剃完毛以后，收拾完以后，把那个整个腹部的耦合剂就先涂上，这样它会有一点点时间，慢慢的就是浸润到这个皮肤的纹理之间，之后它的影像质量会比较好。
So sometimes people will ask why we use gel versus alcohol.
我们来比较一下，用耦合剂还是用酒精。
And I prefer to use gel when possible for scanning.
他个人比较喜欢用耦合剂，在探查的时候尽量用耦合剂。
It typically will give you a better image and lasts longer than alcohol.
一个是它对你的图像质量来说比较好，另外一个是它的持续时间会比酒精长。
Because alcohol will dry quickly, you have to keep reapplying.
因为那酒精的话，它干得比较快，然后你就要不停地重新再往上面撒。
And I also worry about putting a lot of alcohol on the animal's skin.
另外它也有点担心把太多酒精放到那动物皮肤上。
We do use alcohol for small areas if you've shaved everything already and you have to look at a small area through the fur. Well, I do use alcohol for small areas so I don't have to shave the entire dog.
有时候他们只是要通过一个比较小的身窗去看里面的东西的话，他会剃一点点毛，比较小的一块身窗就出来，然后他拿酒精放在上面，这样去看一下。
And then we do use alcohol for aspirates and biopsies because you don't want to put the needle through the gel.
然后另外的话，在我们进行超声活组织采样和细针抽吸的时候，会用到酒精，因为你不希望那个针穿过那个胶层。
So here's an example of a patient who's going to be scanned in lateral recumbency.
这是一个动物在要进行侧卧超声检查的时候的准备工作。
So you can see he shaved He's got quite a lot shaved, and then we have the gel on, so we're getting ready to scan.
他被剃了挺大一块的毛，然后我们已经放了那些耦合剂上去，他可以开始检查了。
So this is an example. This image here is an image through fur.
这是一个例子，就是这个图像呢是没有剃毛就开始做的。
So just to support that, it's best if you can clip the fur or shave the fur. It's going to give you a better image.
这个图像放在这里呢，只是为了大家能够尽量多的给那个动物剃毛。如果说你可以的话，因为这样的话你图像质量会比较好一点。
And imaging through the fur is difficult, but it can be done in cases where you need to.
然后透过那个毛发来检查的话是比较困难的，但是如果你一定要做的话，也是可以操作的。
Yes, ma'am.
Sorry, is there any benefit to spritzing with alcohol and then using gel? 'Cause I've seen some people do that.
Okay, good. The question is about, is there a benefit to putting alcohol on the abdomen and then putting gel on top of that?
他的问题是，如果说我先在那个动物身上撒一点酒精，然后再放那个耦合剂的话，这是不是更好一点？
I guess I don't see a huge benefit myself, and I don't do that. But I have seen people do that.
这位老师说他自己没有觉得这个对影像质量有多大的那个改变，所以他自己不做，但是他确实看到有人是这么做的。
So I guess the one benefit you might get is when you first start scanning, maybe you'll get a better image because the gel does kind of soak in a little bit and can improve your image as you go potentially.
有可能你觉得它的优点就在于，在你刚刚开始的检查的时候，它那个有酒精的存在会使那个耦合剂更加容易的浸润到那个皮肤和你之间，但是也只是一点点吧。
But I guess I don't notice a problem with gel only, and I personally don't like to use a whole lot of alcohol, so that's why I don't.
然后首先他是觉得他没有觉得光用耦合剂对他的影像质量有任何的不好的影响，然后他也不是很喜欢用很多酒精在动物的身上，皮肤上尤其是，所以他自己本身不太喜欢放很多酒精，他就不太愿意用。
Yes, sir.
Will their animal is an allergy to the alcohol, or what problem will cause when we use too much alcohol on the skin?
Do you notice a problem? Is the question?
Yes. Is there some
Is there
animal?
a problem with using alcohol?
And is there some animal with allergy to the alcohol?
Yes, there probably are some animals with allergies to alcohol.
他的问题是你问老师为什么不太愿意用酒精，是不是觉得有些动物会对酒精过敏，还是有其他的不良影响？老师说可能是有一些动物会对酒精过敏。
But I guess I have not seen that yet, but I think it can happen, and they can also have a sensitivity to the gel. Very unlikely.
然后他没有见过有动物发生这样子的酒精的过敏反应，但是有这样子的可能性会发生。同时还有一些动物的话，它甚至也有可能会对那个耦合剂有一点过敏感。
那个使用酒精会加速探头上面的胶皮的老化吗？
If you use too much alcohol, will that accelerate the probe?
The probe
Yeah.
damage.
Yeah, damage.
I have heard that too. I think in general, a little bit of alcohol is safe for your probe.
他也听说过这样的事情，但是他觉得一点点酒精的话还是安全的。
But I have heard companies warn against or advise you to not use alcohol.
但是有些那个生产商的话，他会提示你不要去这么做。
So I think it's another reason to try to keep as little alcohol in the probe as possible.
所以这可能也是另外一个原因，尽量不要在产品上用酒精。
But you could, if you're purchasing a machine or have a machine, you could ask your vendor what they recommend or for alcohol in their probe.
那如果说你要准备买机器或者你有那个机器的话，你可以问一下你的那个厂方，他们对那个酒精的话有什么样的一个说法。
Okay, so which probes do we use?
然后下面进入到下一个问题，我们用哪个探头呢？
I like to use a lower megahertz probe, so 5 to 7 megahertz for deeper structures in dogs.
他比较喜欢用低频率的5到7.5兆赫兹的来检查犬的声部。
And these are usually a sector or curvilinear probe.
通常的话就是一个扇形的或者是那个曲线的那个探头。
And again, I'll use this for the deeper structures or the bigger structures, so the liver, the head of the spleen, and then maybe the kidneys and adrenals, depending on the size of the dog.
然后一些比较大、比较深的脏器的话，包括脾脏的头部、肝脏，然后有时候肾脏和肾上腺，根据你狗的大小而定。
And while I'm using this lower frequency probe, I do a sweep of the entire abdomen to make sure I'm not missing anything that's deep.
当他用这种低频率探头的时候，他会首先扫查整个腹腔，然后确定他没有错过任何深部的病变。
And then I'll switch to a higher frequency probe, so somewhere in the range of 7.5 to 13 megahertz for more superficial structures in dogs and often the entire abdomen in cats.
然后他会再换到一个比较高频率的一个探头，7.5到13兆赫兹，用来检查犬的那个浅表肌宽和基本上猫的整个腹部。
And these higher frequency probes are usually linear probes, but they may be curvilinear.
这些高频的探头的话，它大部分是线正的，但是也有可能是曲线正的。
And the higher frequency probes are good for the body of the spleen, potentially the kidneys or adrenals, the bladder, the GI tract, and lymph nodes.
这些高分辨率的探头的话，它相对来说对脾脏的体部、肾脏、肾上腺、膀胱、消化道和淋巴结的检查比较有用。
So for patient position, I personally prefer dorsal recumbency with the patients on their back.
关于动物的摆位，他个人的话比较喜欢让动物仰卧。
For me, it's easier when they're in this position to keep the anatomy straight and to relate organs.
然后这样子的话，首先他们摆位比较直，它可以使腹部里面的脏器都处于一个正常的一个解剖位置。
Then we put the patients in troughs, padded troughs, so that they're more comfortable on their backs.
我们一般会用那个软的那种槽，使那个动物感觉在睡在被窝位的时候也比较舒服。
But you can also scan in lateral recumbency, and some people prefer this.
然后你也可以让它侧卧检查，有些人的话比较喜欢这个位置。
And even if you don't prefer this, it may be good for certain patients who are having difficulty breathing, so it's good to practice.
然后有时候尽管你不喜欢这个侧卧的保定方式，但是如果碰到像这种呼吸困难的动物的话，侧卧还是比较好的。
And some people find certain structures are easier to find when the patients are in lateral recumbency, and in particular adrenal glands and medial iliac lymph nodes.
有些人的话会觉得，有些器官在侧卧的时候更加容易找，比如说像肾上腺，或者是那个卡中淋巴结。
So here's a dog in our clinic in the trough in dorsal recumbency.
这是他们那个诊所的一个狗，底下那个蓝色的，大家可以看到，就是它的那个槽，它是仰卧保定的。
And they're usually fairly comfortable, and we use 2 people to hold them, but usually that's all we need.
然后基本上他们睡在这个槽里面的话，还是觉得蛮舒服的。一般我们需要2个人保定，但是基本上也就只需要2个人。
And again, here's another example of a patient in lateral recumbency.
然后另外一个照片的话，就是这个动物是在侧卧。
All right, so when you're scanning an abdomen, you need to approach it like you do anything in diagnostic imaging and use a systematic approach.
当你在做腹部的 B 超的时候，你要像做任何其他影像学检查一样，用一个比较系统的方法来检查它。
You should look at the same organs in the same order every time.
你需要每次都按一定的顺序来检查这个各个器官。
And I try to make a point of ignoring lesions, even if there's a very large mass. I don't image that until I get to that in my order so that I don't miss anything.
他的一个习惯就是，哪怕他一下子就能感觉到那边有个大的肿块，但是他也不会直接去检查那个肿块，而是要根据他自己习惯的那个系统的检查方法，直到他检查到肿块的那个位置。这样的话，他就不会遗漏其他的问题。
So I'll just tell you how I go through an abdomen, but you'll have to take different people's opinions and find out what works best for you and use that every time.
他会告诉你，他自己的一个常规的一个系统检查方法，啊，你可以跟不同的人进行交流，然后最后总结出一个最适合你自己的一个方法。
So what I use is a combination of a region and an organ system.
它一般是用了一个组合，就是这个区域的一个位置，再加上整个器官系统相结合的一个方法。
So the basic order for me is liver, spleen, urinary system, GI tract, and then other things.
首先，它这个基础的一个顺序就是肝脏、脾脏、泌尿系统、肠道还有其他。
So I'll start with my lower frequency probe and look at all of the liver, and then the